Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. We appreciate you guys coming on more than you know. No, we love saying hello too, if you can. And if the scroll is working this morning, I might be able to give you a little bit of love back to you because you give us so much love heading our way. Okay, there's Brahim, and he's number one on the hit parade this morning. How are you? Elaine, good morning to you. And Lisa, love having you guys on. Hi, Sandy, Fergus Falls, Minnesota, and Andrea in Niagara Falls. Rosalinda, Niagara Falls. Nativity's on with us this morning. And Rosa from Montreal, always near the top. Sharon, good morning. Janine and Sandra. Kevin, the mayor, is on with us this morning. 5 years you've been listening, he said. Lorraine, British Columbia. Maureen, Boca Raton, Georgie. Halifax, Nova Scotia. Lori is in Cambridge. And Helga from Scarborough. Hi, Roxanne. Out in Edmonton, Alberta. Yvonne, Petawawa. Patricia, Florida. John from Wyoming. Sandy, Chilliwack, British Columbia. Hi, Fran in Orangeville. Brandon. And Craig and Darla, I think. Jose, how are you? Patricia from Pulaski, Tennessee. Catherine. Dennis from Norwich. Madalena. Sherry is on with us from Mississauga. Karen from Minising. Roxanne. Dave from Muskoka. Muskoka. Nellie. Carol is on from West Virginia. Oh, I want to sing, Carol. Maria, Denise from Oakville. Chaz. And Bruno from North Bay. Vanda from PEI. And isn't it crazy, how long we've been getting together? Sandy. And Claudette and Karen from Peterborough. Guys, we love you. Thanks for coming on. Hi, Bev in New Brunswick. And Wanda in Ridgeway. Marilyn from PEI. Oh, look at that. Brahim's on the Oregon coast. Having a holiday, I think, eh? Gail, Annie, Dave and Helga, Gwen, Doris. You guys are wonderful. Bruno not scrolling. Yeah, I don't know. I can't help you. Hi, Luella, West Tennessee. Francis and Vaughn. John's on with us from Owen Sound. Sylvia from MISSI. Rose. Kristen. Annalisa. North Bay. Milika. Good morning. Okay, let's get going or we won't get to these questions. Serpa's on. Donna's on with Newfoundland. Elaine, we love you guys. You have no idea how much. Okay. Lori, my both daughters have PCOS. No, they don't. They have PMOS. Did you not hear, Lori, that they changed the name of polycystic ovarian disorder, okay, to, they don't talk about the cyst anymore. They talk about PMOS, okay? And metabolic syndrome, ovarian disorder. Because they know that the formerly called PCOS is caused by insulin and estrogen. Insulin and estrogen. Metabolic syndrome. And women that get this, Their hormones are completely out of whack. Way too much estrogen and way too much insulin. It's a bad combination. And it affects their hormones. Now, here's the question that Lori was asking me, okay? Her 21-year-old is feeling so tired and has a hard time getting out of bed, headaches, yeah, the same symptoms. But one of the sisters started to take liquid iron. Good idea. Feels so much better. Yeah, because usually their menses are terrible and blood loss and they don't feel good and they're anemic. I would add to the liquid iron, Lori, and certainly for your other daughter, absolutely. You can take liquid iron. Like, I got no issue with that at all. Okay, especially in women, especially if they're not eating a lot of steak, and it's good for them. Now, it would be better if I had their numbers. I had their ferritin. But the other thing they should be on is B12. That I can guarantee you is not optimized either. Okay? So iron without B12, man, I don't like that so much. But I like the liquid iron. I got no issue with that. Okay? And they have PEMOS, not PCOS anymore. Isn't that crazy, eh? They've actually listened to me. And they changed the name. Officially. Okay. Mona's had a bad thyroid for years. Cluster of nodules present, okay? Doctor's not too worried about it, but she is. Are they dangerous? Nah, not necessarily, but you just have to understand what's going on, Mona, okay? Here's what's going on. You're in a storm, okay? So let me take some teaching out. I got to do it again, okay? I'm going to take my pyramid out, okay? Because I used to take it out with my patients every day, and I would explain hormones, okay? Mona, your thyroid is not independent. It's not independent of your other hormones. They go together. Your thyroid is like a puppet. It has a lot of strings attached to it. So you have to do all of the above, okay? Now watch what I'm going to show you with this chart, okay? So it's a pyramid. I flunked art. So don't look at my artwork. And for those listening on a podcast, use your imagination. I've got a pyramid in front of you. At the top of the pyramid is your thyroid. That doesn't make it the number one organ there, but it's important because they all are, okay? So you have the thyroid. Right in the middle, you have your insulin. That's your pancreas. So whatever you eat is going to affect your pancreas and the secretion of insulin, and that has a big effect on your hormones. You can't just, well, I got nodules and my thyroid's not working and not think of diet. You better think of diet, because diet's really important in this too, okay? And then halfway down the pyramid, I got your adrenal glands, adrenal, on top of kidneys. What is that, doc? Well, that's where you secrete cortisol. Cortisol is your stress hormone. And it has a major effect on your hormones. It pours gasoline on the fire of hormones. It makes everything worse. Why does it do that? Because cortisol robs your ovaries of progesterone. What does that do? Oh, that elevates your estrogen. You become what they call estrogen dominant. And I don't care how old you are. Oh, Dr. Martin, my estrogen's going down. I'm going into perimenopause or I'm menopausal. I don't care. You're still more dominant in estrogen than you are in progesterone. What does that do? Well, estrogen slows your thyroid to a crawl. And I always add a little circle over here, your liver. Okay? See that little blue here? That's your liver. What happens in the liver doesn't stay in the liver. It's not Las Vegas. In the liver is where you convert T4 to T3. But if your liver is full of fat because you're a carboholic or a sugarholic, you're not converting T4 to T3. Your thyroid needs T3. So in the liver, you're not clearing the extra estrogen and you're not converting properly T4 to T3. What does that do? The thyroid. You look at food sideways and you gain weight. You lose your hair. You grow hair where you don't want hair. When I go to get my hair cut, I grow hair where I don't want it. I don't have enough on the top, but I got it coming out my ears and out my nose and my eyebrows. I say, cut that, would you? But women, they get hairs on their little chinny chin. Some women get a little mustache. It's hormones. Okay? And if you don't put all this together, why do you think you ladies fall through the crack? Okay? In medicine. You fall through the cracks in medicine. Why? Because they're in love with your numbers. And if the labs don't say nothing, they don't care. Because they're in love with labs rather than understanding the physiology, how this all works together. So I taught this to my patients for years and years and years. I said, you need to balance this. Food. Dim out your estrogen. Build up your progesterone. Food with insulin. Empty the liver. Food. Lower your cortisol. Very important because it's all connected. Okay? So that's the teaching. Okay? I could go on for an hour on the teaching of this. But, okay, so that's why when you ask me, Mona, okay, my TSH, your number is all right. But again, I go more on symptoms. I would appreciate receiving any feedback. For many years, suffered with terrible sleep. Yeah, that's your cortisol, Mona. It's your cortisol. When cortisol is high, you don't sleep. When you don't sleep, your cortisol is high. Got to fix that. And Rome wasn't built in a day. But you can do this, okay? Appreciate the question. Kathy, what's your opinion on beetroot? Well, I see a lot of commercials for it. It elevates your nitric oxide. Look, it's good. You know me. Good, better, best. The best to elevate nitric oxide, okay, is Navital. The second best is vitamin D. The sun. Sun, steak, and steel. Have you heard that before? Okay. Beetroot, I got no problem with it. I don't. But I don't find that's the best to elevate. Okay. That's what I always say with Navital. Doc, what does Navital do? Blood supply. It gives you more blood supply to the brain. Proven. Crosses the blood-brain barrier. To your organs. To your legs. Circulation. That's why I've always been big. Men with prostate. Navital. Pine bark. Okay. Thank you, Kathy. Lorraine. Her sister is 67. Horseshoe kidney now has very severe chronic disease. Kidney disease. And will start dialysis soon. No fun. No fun. Okay? Now, is it too late for kidneys? Is there damage that far advanced when they need dialysis? That is no fun under the sun. And you're saying to Lorraine that she's got very high potassium numbers. Yeah, well, that's an indication. When your potassium is high in your blood, your kidneys ain't working. So they'll have her on a very restrictive diet. Look, I find with potassium, when it's high, you got to really watch, especially things you drink with high potassium, like tomato juice and orange juice. Like, I don't like that stuff anyways. You know me, I don't want, if you're going to eat a fruit, eat it. Don't drink it. But it's really important not to get a lot of potassium, like in potatoes and tomatoes and avocados and that. You know, avocado is good for you, but not if you have chronic kidney disease because your potassium is so high. They'll probably have her on a diuretic. I'm sure she's already on a diuretic for that, okay? How much help you can give her? Well, you know, look, I mean, it's not like I didn't see chronic kidney disease, okay? I did. Water, coffee, that's what you drink. Lots of water. You can drink coffee. No tea because of oxalates. Nothing with oxalates. That damages the kidneys even more. Very low carbohydrate. You know me, I talk about insulin and sugar, like no sugar whatsoever. And let's see, I would have her on Navital, high DHA, if she will go on it. Believe me, she had nothing to lose. Because it's so advanced. Okay. Thank you, Lorraine. Joanne, is fluoride good for you? Well, look, it's a mineral. You know, dentists go crazy with fluoride. I'm not that big on it, okay? Because they want, you know, they put it in the water and they, you know, like everything has to do with your teeth. Yeah, but, you know, at certain levels, it's toxic. So they always say never give a child fluoride. Well, why would, you know, if you can't give a child fluoride, why would it be good for you? Look, I'm not big on it, but, you know, a lot of water systems, they got fluoride in their water and the dentists got their way and I was never big on that. Okay. So is it good for you? Yeah. Not the way I see it, Joanne. Francis has a friend who has neuropathy. Side effects from chemo. I answered another one last week too, Francis. Yeah, like neuropathy, chemo is very, very powerful, okay? And oftentimes one of the major side effects is neuropathy. And here's me. For neuropathy, I like a combination of B12 because it's the nerve vitamin, the myelin sheath of your nerves. B12, very, very, very important, okay? And with, again, blood supply, because blood supply and nerve supply go together. That's why I like pine bark extract. That's why I like Navitol in combination with B12. So neuropathy, B12, Navitol. I've been doing that for years, guys. For years and years. 30 years, more. Oh, somebody's asking again about iron, but this time it's about infusion. Francis, what do you think of IV iron infusion for low iron? Well, you're going to be extremely low if they're recommending an iron infusion by IV. If you're that low, you might not have any choice but to get an infusion of iron. Look, I really don't like it when people have to get to that. But if it's happening, I've seen it with endometriosis. I've seen it with severe PCOS. I've seen it. Heavy menses. I've seen women have to get iron infusion. If you need it, you need it. In the meantime, you better be eating steak. Alice, she had breast cancer, and they are now going to do radiation after the pill for cancer. Okay, Alice. Well, look, I mean, the biggest thing in cancer, breast cancer, is this, okay? Because I always talk about this. There's two hormones, the same in PCOS as breast cancer. Estrogen, growth hormone. It makes you a woman. That's what estrogen is, okay? It's lovely until you have too much of it. I used to tell women, you're too much of a woman. And I don't mean that as a compliment, because you got too much estrogen. I used to do a scan in my office of estrogen. It come out like leper spots. I said, man, oh man, you're too much of a woman. Well, you want to lower that. So you need DIM. And that's one of the reasons I like flax seeds. You need to lower your insulin. Insulin is a growth hormone. It makes things grow. It makes cancer grow. You want to lower that. How do you lower it? Cut out your sugars. Sugar feeds cancer. Cut it out. Cut it out. No sugar. No drinking sweet juices of any kind, unless you're using Dr. Martin's Perfect Smoothie, because it ain't sweet. It's fat. It's not sugar. It's fat. And fat don't make you fat. Okay? So I'd have you on, it's very important with cancer, especially breast cancer. Find out what your vitamin D levels are. In the United States, we shoot for between 80 and 100 numbers, NGML. In Canada, 200 to 250 NMOL-L. Get your blood work done. Find out what your vitamin D is. Because someone else is asking. Let me answer the question right now. Might as well. Thomas, and then I'll come back to you, Alice, okay? Thomas is asking the question. The sun is out. Hallelujah. Well, not today here, but we've had the sun the last few days. It's been wonderful. Okay? Where have you been all my life? Looking for the sun. Okay. If I sit outside 20 minutes every morning, and if I get good 5 days of sun, should I still have to supplement with vitamin D? Well, it depends. Okay? If you get 3 or 4, 5 days usually of 20 minutes of the sun, and you're letting it come in on your solar panels, where are your solar panels? Your best ones. They're on your arms and your legs. No sunscreen. No covering up. 20 minutes. Okay? And you get 10,000 IUs. Now, if you have darker skin, you might get less. Don't put sunscreen on. Okay? At any time. as far as I'm concerned. So, Thomas, the best answer, though, is to try and find out what your vitamin D levels are. Because then you can adjust, okay? Because some people, you might have reasons for you're not absorbing vitamin D as much as the guy next to you. And you might need to supplement your vitamin D, okay? And so that's a good question. But back now to Alice. You need to be taking vitamin D. Find out what your vitamin D levels are, and you should be on at least about 8 to 10,000 IUs of vitamin D, because vitamin D, breast cancer hates vitamin D. Breast cancer hates steak. It hates it. Okay? Get your cortisol down. The stress hormone pours gasoline on cancer cells. No sugar. Diet-wise. I'm big on high DHA. Why? Because there are studies, there are not many, but there's a few that show it's a tumor buster. High DHA oil. It's a tumor buster. The high DHA omega-3. Okay? I love curcumin. Look at the studies on curcumin in cancer. Okay? So curcumin is an extract of turmeric. Turmeric won't do it. You need the extract, is the curcumin, because that's what is bioavailable in your body, okay? And make sure it has black pepper attached to it. Okay. That was Francis. Know that. It was Francis. And the other Francis asked about low iron. And that wasn't Francis. That was Alice. Okay. Sorry, Alice. There's Francis, another Francis, and Alice. And I was all mixed up. Okay. Diane, I know Dr. Martin is not concerned with high LDL. Nope. And you can't make me concerned about it. You just can't. Because it ain't true. If it was true, we would have got rid of heart disease by now. Heart disease is worse than ever. The proof is in the pudding. The results are in. They've been studying this for 40 years. You know what they're finding? Cholesterol is not at the root of heart disease. I'm sorry, it's just not. Okay? So you're right, Diane. I know Dr. Martin is not concerned with high DHL, but with good triglycerides and HDL, yes. That is an indicator of heart disease. If you got high triglycerides and low cholesterol, HDL cholesterol, you're in doo-doo. You're in trouble. And they don't like talking about that because that has to do with food. The world medicine wants you on meds, statin drugs, okay? Now, Diane is asking, is high ApoB more of a concern, or does he feel the same way as he does about LDL? Yeah. Okay, look. What do I call Apo? Capital A. P-O, B, or A. It's just particle size of cholesterol. They're into weeds. Why do they put you into the weeds? Because when you read stuff about LDL cholesterol, because they've been looking at this for a long time and the results are in, LDL cholesterol, I'm sorry, you can lower it all you want. That's not going to save you from a heart attack. It won't. It won't. I'm sorry, it doesn't. And so what did they do? Well, we better get into something else. And this is very confusing. They get into APO. Small particle cholesterol, large particle cholesterol. It gives me a migraine. It's weeds. It's a reason to keep you on statin drugs. Man, they're good at it. You know what you got to give the pharmaceuticals? You got to give them a high five. They are so good at marketing. I'm telling you, they scare the living life out of people. You're going to have a heart attack. And they go after not even you as much as they go after the doctors. They scare the life out of doctors. What if you don't put them on a statin drug? They're going to have a heart attack. And they scare the life out of doctors. But you can't, I'm not convinced. I read this stuff every day. I study every day. I look at every study that comes before me on cholesterol and statin drugs. And it ain't pretty. If statin drugs worked, we would have got rid of heart disease a long time ago. But we haven't. If you left it to the pharmaceuticals, they put that statin in our drinking water and make you drink it. But it's not good science, guys. You're better off looking at your triglycerides and your HDL. That tells you a lot more. You're far better off looking at your inflammation markers for heart disease. You're far better off looking at your A1C for heart disease. Ask a diabetic. The proof is in the pudding. Sugar destroys blood vessels. A fact. Not fat. Sugar. Not cholesterol. Sugar. Not steak. Sugar. I'm excited. Okay, let's see. I might be able to get through this today. Debbie is asking, what does Dr. Martin think of getting a colonoscopy? Well, listen, that's up to you. I give information. Okay? I give information. People ask me about that. They used to ask me in practice every day about colonoscopy. What, Dr. Martin, what do you think? Well, just know it's a two-edged sword. Okay? It's there for detection. They want to go look and see if you got any polyps or whatever. And medicine is in love with colonoscopies. But, and there's a big but there. Pardon the pun. Okay? Because colonoscopies are very invasive. Okay? Very invasive. So, you got to weigh that. I'm not going to tell you what to do on that. Okay? I'm not, because you're not my patient. I'm an information guy. I'm giving people information. Okay? So, that's where I come from. Thanks for the question. I appreciate it very much. And that was Debbie. Mary, can the reset help pancreatitis? Absolutely can, because pancreatitis, your pancreas, you know when you get pancreatitis, why do we see so much pancreatitis today? Okay? Because people are carboholics. They're carboholics. Your body was never meant to secrete that much insulin. And when people get pancreatitis, the number one cause is because they're secreting way too much insulin. They're carboholics. And you can get pancreatitis because your gallbladder releases a stone and it can get caught in the duct, and that can be very dangerous to your pancreas. But how do you get stones in your gallbladder? You know how? Because you don't eat enough meat. You're eating too many plant kingdom and too much carbs. Use it or lose it. That's how you form a stone, because stones form in the gallbladder because you haven't used. The gallbladder is a little reservoir. It empties its bile into the small intestine to emulsify fat and to change the pH. It's important, but if you're not using it, you lose it. That's why so many people lose their gallbladder, or they can get a pancreatitis from a stone being lodged between the gallbladder and the pancreas. But it's the diet mostly, guys. And estrogen's involved, I must admit. Not enough progesterone, too much estrogen in women. Okay. Any idea about working through allergy season? Here I go again with Navital and quercetin. My go-to for allergies. This is the season, okay? Mostly. Quercetin, antihistamine. Navital, antihistamine, anti-inflammatory. I find the combination of two, 4 and 4. 4 Navital, 4 quercetin, unreal. I put it up against anything, any antihistamine, and no dopey feeling. Okay? I love that combo. Okay. Another Francis. My word. My husband had a small TIA, a little stroke, mini stroke, and they put him on Ozempic to manage his visceral fat. He's not overweight. Francis, I'm getting a migraine, okay? Because why would they put him on Ozempic? What was his A1C? 5.7. Okay, a little bit elevated, but to put him on Ozempic. Is he a good eater? Is he, they want him to double his statins and take an aspirin every day. Well, I put out, it went viral. This is one thing that went viral years ago, okay? I put out a video on the American Heart Association and the FDA. They came out against aspirin. They said, nah, the benefits are outweighed by the side effects, big time, okay? So, and I did it, and some people were mad at me on the video. I said, look, I'm just telling you what the FDA said. And the American Heart Association, why are you coming after me? I'm just a messenger. Anyway, it hit in the millions of views, guys. It went viral, and this is, well over 10 years ago. Oh, yes, for sure. Oh, yeah, well over 10 years ago I did that. If I ever find it again, I'll put it out there again. You'll see a younger Dr. Martin. Okay, let me get to the questions, Francis, okay? Is triglycerides and HDL are not bad at all? I'm confused. Francis, I understand, Francis, why you're confused. And again, I bring you back to the broad road, very popular. Medicine is in love with statins, aspirin, blood thinners. And I'm not saying not to get on them. Your husband had a stroke. I can't tell him not to. Okay? I can't tell him not to. But, I like his triglycerides. I like his HDL. It could be a little bit better from what you're showing me there, but I'd have it a little bit lower on the triglycerides, and his HDL a little bit higher. One thing for sure, I'd have them on Navital, blood supply. High DHA, lubricating the blood vessels, for sure, for sure, for sure. Vitamin D, find out what his levels are. Very, very important for blood vessels is vitamin D. It's important for everything. Sun, steak, and steel. And sleep. And coffee. Anything else I put in there? Sun, steak, steel, sleep, coffee. Thanks, Francis. Okay, only 2 more. Kim, I've been following EMC for a couple of years now. Okay? Few healthy carbs, but doing really well. Okay? I've been taking the menopausal supplement. That's to get her estrogen down and elevate. See, you're doing 2 things, Kim. The menopausal formula does this. It's got DIM. It lowers extra estrogen. Estrogen is wonderful, but you don't want too much of it. And I don't care if you're menopausal, perimenopausal, or whatever ausal you are. You need to get estrogen off your body, okay? Especially around your breast tissue. Get that away from there. And that's what DIM does. I've proven it to tens of thousands of people. Secondly, okay? You want to elevate your progesterone, because progesterone is so wonderful for you. So that's what the menopausal formula does. It does 2 things. Elevates progesterone, lowers estrogen with the DIM. Okay? Okay, what else are you asking? I want to make sure my estrogen progesterone is balanced. Well, you're doing the right thing. I take 2 tablespoons of ground flax every day. Good for you. And bone broth. You're a smart girl. Holy moly, Kim. Do you think I'm getting enough DIM in the flax? To stop the menopausal? I wouldn't stop it. Don't stop it. Look, I love flaxseed. You guys know that. It's got DIM. It dims out the estrogen. But I would want for you, Kim, to keep your progesterone levels up. Okay? And you can't get too much DIM, so don't worry about it. Okay, thank you for the question. I love you. Suzanne, my doctor ordered ultrasound for both your shoulders. The results were calcification. Okay? You got calcified tendons, and they showed up. Okay? He recommended surgery or needle. Well, again, it's hard for me, Suzanne, to tell you what to do, because surgery's pretty aggressive on shoulders. Shoulders are problems because you don't have a lot of blood supply in your shoulders. Okay? And anything you do in there, are you getting frozen shoulder, Suzanne? Let me know that, because I can give you more advice. They did an ultrasound probably for a reason, because your shoulders are killing you, right? True? I don't know that because you didn't say that, okay? I have inflammation and calcification. Okay, so if you have inflammation, you got pain. Okay? And the calcification, your body lays that calcium down so that you won't move your shoulders. Because when you move, it hurts. Okay? So that's what I'm saying is your body is trying to stop you from movement. The worst thing you can do is not move your shoulders because they're avascular joints. One of the best exercises you can do, get a broom handle, okay, or a broom, a golf club, something very light, lay flat on your back and bring that stick or broom or whatever over your shoulders. You're laying flat on your back. I used to get patients to keep a yardstick by their bed, not to hit their husband, But to do an exercise in the middle of the night when their shoulders were killing them. Shoulders are no fun because they're avascular. They don't have a lot of blood supply, just like your hip. When the hip starts deteriorating, it ain't no fun because there's not a lot of blood there. Blood brings healing. Move. Passive exercises. I would have you on curcumin. Okay? Navitol and curcumin for your shoulders. Okay. I got through, guys. I wanted to finish. So Monday we'll do some studies. Okay, I had to breathe because I was getting excited. Love you guys dearly, sincerely, and every other way. Talk to you soon.